The rain had been going for 3 hours straight, and the power in the east wing had flickered twice already. I was on my second cup of terrible vending machine coffee, the kind that tastes like someone described coffee to a machine that had never actually met coffee, when the charge nurse poked her head around the corner and said, "Room 14, he's refusing the injection again." Again. I picked up my little tray and walked down the corridor, listening to my sneakers squeak on the linoleum in that particular rhythm that only happens on night shifts, when the whole building gets quiet enough that you can hear yourself think. Or, in my case, hear yourself rehearse what you're going to say to a grown man who is, apparently, terrified of a needle the width of a human hair. I knocked twice, pushed the door open slowly. He was sitting up in the bed, late 30s maybe, dark circles under his eyes, the kind of jaw that probably looked better when he'd last slept. He had his arms crossed, not aggressively, more like self-protective, like he was holding himself together by the pressure of his own hands. "Hi," I said. Just that. Not, "Good evening, sir," or, "I'm here for your injection." Just, "Hi." He looked at me. "You're younger than I expected." "You're more nervous than I expected," I said. And I expected pretty nervous. That got the tiniest corner of a smile. Good. That's always the first thing. Not the needle, not the technique, not any of it. The first thing is always just getting someone to breathe. I set my tray down on the bedside table and pulled up the little stool. I didn't stand over him. That matters more than people realize. When you stand, you're a medical professional administering a procedure. When you sit, you're a person having a conversation that happens to involve a syringe. "So," I said, "what's the story? Bad experience before?" He exhaled. "When I was a kid, dentist, wrong angle, hit a nerve, and yeah, I know it's not the same thing. I know it's irrational." "It's not irrational," I said. "Your nervous system doesn't know the difference between a bad memory and a current threat. It's doing its job. It's just overachieving a little." He laughed at that, a real one, short and surprised. His name was Daniel. He'd come in with a flare-up of something he'd been managing badly for months, partly because he worked too much, partly because he'd been quietly hoping it would just resolve on its own, the way men sometimes do with things that scare them. He needed an intramuscular injection, a medication that doesn't come in oral form, which meant no negotiating around it. It had to go in the muscle. That was just the reality of the situation. "Okay," I said. "Can I tell you what I'm actually going to do? Not the scary version. The real version." He nodded. "The site I'm using is the outer upper part of your thigh. Not the top, not the inner side, the lateral part. Right here." I touched my own leg to show him, just lightly, through the fabric. There's a lot of muscle there and very few nerves close to the surface, which means most people feel almost nothing. The ones who feel something describe it as pressure, not pain. And it lasts maybe 2 seconds. 2 seconds, he repeated. 2 seconds. I've been doing this long enough that I can tell you, the anticipation is always worse than the event. Always. I put on my gloves. I like that moment, actually. There's something grounding about it. The way the latex settles over your fingers, the slight resistance, and then the give. You become a different version of yourself, more precise, more present. I asked him to relax his leg, not to tense it, which is everyone's instinct, but to let it go soft. A tense muscle is harder to penetrate cleanly, and it bruises more afterward. I told him to let his foot fall naturally to the side if it wanted to. He did. I cleaned the site with an alcohol swab, let it dry for a few seconds, People skip that step and they shouldn't because wet alcohol on broken skin stings more than it needs to. I uncapped the syringe. I held it the way you hold a pen, not a dart, controlled, angled at about 90 degrees, because intramuscular means you're going straight down into the tissue, not at a shallow angle like an IV or subcutaneous injection. "Tell me something," I said, not looking up from his leg. "What?" "Anything. What do you do for work?" "I'm an architect," he said, and he started to say something else about a project, and I administered the injection in the middle of his second word. He stopped talking, looked down. That was it," I said. I withdrew the needle smoothly, applied light pressure with a clean gauze pad, not rubbing, pressing. Rubbing can push the medication into the wrong tissue layer, and it also just doesn't feel good. Gentle, steady pressure for about 10 seconds. I barely felt that. "I know," I said, not smugly, just, "I know." Because that's how it goes when you do it right. The needle is sharp enough that the skin doesn't resist it. The angle is correct. The muscle is relaxed. The whole thing is over before the brain has time to decide to be afraid. I disposed of the syringe immediately. Never recap, never set it down, straight into the sharps container, every single time without exception. That's not a rule you follow when you remember. That's a rule you follow like breathing. I peeled off my gloves, washed my hands at the small sink in the corner. "How's the leg feel?" I asked. "Fine, normal, maybe a little warm." That's the medication dispersing into the muscle. It'll absorb over the next 20 minutes or so. If it gets sore tomorrow, and it might, a little, a warm compress for 10 minutes will help. Not ice. Warmth helps the muscle relax and speeds up absorption. He was quiet for a moment. The rain was still going outside, tapping against the window in that irregular way rain has, like it's trying to find a rhythm and keeps losing it. "I've been putting this off for 6 weeks, he said. "I know, it's in your chart." "Was it that obvious?" "Little bit," I said. I gathered my tray. "But you did it. That's the part that counts." He looked at me with this expression I've seen before. Not gratitude exactly, more like relief that's slightly embarrassed by itself, like he'd expected to need to be braver than it turned out he needed to be. "One more thing," I said, pausing at the door. "Your blood pressure was elevated when you came in. That can happen with pain and stress, so we'll check it again before discharge. But if it's still high when you're calm and rested, actually rested, not just lying down while worrying, you should follow up with your primary care doctor. Not in 6 weeks. Soon." He nodded, seriously this time. "Get some sleep," I said. "The good kind." I pulled the door closed behind me, and the corridor was quiet again, and the rain kept going, and somewhere down the hall a monitor beeped twice and then settled. There's a version of this job that's about procedures and protocols and the correct angle of a needle. And all of that matters. It matters enormously, actually, because precision is a form of care. But underneath all of it, what I think about when I walk away from a room like that one is something simpler. He came in holding himself together with both arms. He left with his hands in his lap. That's the whole story, really. That's always the whole story.